So you began to touch on it, Dr. Stoll, about some of these neurological things that we have identified with the COVID-19 virus. Are there others? Should we be worried about other neurological signs? I mean, some people talk about brain fog, so it would suggest something more centrally in the brain.
Yeah, that's something that we can see. We can see neurologic symptoms in up to 30% of COVID patients. And that's not something that we consider relapsing remitting form of the disease. That's something that we consider coined long haulers. These are patients that have the viral illness. They develop severe muscle aches, muscle fatigue, in addition to all of the other symptoms, the significant cough, difficulty breathing. And once those symptoms subside, patients don't seem to fully recover back to their normal self, in the sense that they still have some aches, malaise, and those patients can develop significant brain fog and chronic headaches. And that's something that can actually persist for several months after the illness seems to have subsided.
Dr. Stoll, a couple of your points really stand out. Number one, COVID-19 is a new disease for all of us that are dealing with it, both as patients and as physicians, and we just don't know the natural history. We don't know early on what's happening. We're not 100% sure what's going to happen later down the line as well. And this study that you discussed with us was in mice, and I don't think we should get too concerned up in panic just yet. And you make the point that there's no evidence that there's going to be long-term problems with your nervous system.
Absolutely. Actually, I'm glad you mentioned that again, because there are other viruses that do attack the brain. For example, rabies is a common virus that we know loves attacking neurons and stays in the brain, and can cause devastating long-term and short-term neurologic effects. Also, something that we're all familiar with, chickenpox. Back when a lot of us had chickenpox, I'm of the age where I didn't get vaccinated. I had chickenpox. The herpes varicella virus is something that loves to go to ganglion cells, which are bulbs of neuron tissue. And that's actually what causes later on, years, 20, 30, 40 years later, can cause shingles, because they stay in the nerves or they stay in the neurons, and then they can disseminate and cause severe neurologic pain later on. Thank God there's no evidence to suggest that COVID-19 hides in the brain or attacks the brain. My colleagues at Yale and at other large academic centers have been looking for it. Trust me, it's not something that we're not looking for, because we do see very rare cases of what seems like devastating neurologic conditions from COVID. So we look for evidence of COVID in the spinal fluid, in brain tissue, and we don't see it in the CSF.